everyone, welcome back. I am Dr. Alexandra. Today's video is a good one. We are going through things that patients bring up in my office that make me kind of pause and ask a few more questions, and maybe have actually made me even say, I don't think that's the best medical care for you. And these things are common, and they're inspired by honestly patient care stories, because sometimes patients don't exactly know that they're doing something that might be harmful for them. So today's video is a good one. If you are new to our channel, welcome. We're super excited that you're here. If you've been watching all along, go ahead and hit the like button, hit the subscribe button, and drop us a comment, because those kind of things help us just to get our channel out there to more women. And really that's the goal, is to help more women. So without further ado, let's jump into our video. The first thing I'm going to talk about today comes up a lot now. And it comes up a lot now because people are trying to do good things to keep themselves healthy over the last couple years. And this is advice that comes out. And that is taking vitamin A as a young woman. So what do I mean as a young woman? I literally mean as a woman who has the ability to get pregnant and is of pregnancy bearing age. And especially women who want to get pregnant or are trying to get pregnant. So a lot of people don't realize that vitamin A, although really, really important, has to be given in specific dosing. Anything over 5,000 milligrams of vitamin A is considered a teratogen, meaning that it can actually cause birth defects in women. And there's vitamin A in a lot more things than you think there is, right? There's like a little bit of vitamin A in your multivitamin usually, right? And then sometimes patients are taking additional supplements with vitamin A in it. We have to make sure that we're adding things up. So for example, we had a patient come in our office the other day who was on a biohacking Facebook group and was taking 25,000 milligrams of vitamin A a day, and is looking to get pregnant. Well, that is not gonna work. That amount of vitamin A will cause birth defects. And so it's the same thing as if we think about Accutane, right? If anybody's ever been on Accutane for acne, the reason why they're so strict with Accutane is because it causes birth defects. Same thing with vitamin A. So my first advice is to watch your vitamin A intake, right? Although vitamin A is helpful and is definitely touted in this time as being something that keeps you healthy, you can take too much of it, especially as a woman who is of pregnancy age and I guess possibility, right? So in that case, you really want to keep your vitamin A less than 5,000 for all vitamin A sources in your supplements. So something to look at. The second thing I'm going to talk about is any time a patient comes in on GI supplements, and again, this is usually from some sort of like YouTube, biohacking, Facebook group, something like that, where they're getting advice from a lot of different sources, maybe not necessarily doctors and probably don't have a good diagnosis. But patients who come in on multiple GI supplements. So they come in and they're on a supplement for candida and SIBO and food allergies, and they're on glutamine, and they've removed all of these things from their diet. In those things, the reason what makes me pause about that is that there's no diagnosis associated with this, right? You don't know if you have SIBO or candida, why you need this probiotic. And I think at that point, right, if you're adding in that many GI supplements and you are not necessarily seeing the benefit, or you don't know what's giving you the benefit, then it's really time to see somebody who knows what they're doing. Get some good testing, right? Get a proper SIBO test run, get a proper stool analysis run, do something so you can get a proper diagnosis, because at that point you're basically throwing the kitchen sink at something and hoping that it works. And sometimes it does. But long term, we can definitely be causing a little bit more harm than good with that. Especially because even the supplements, when it comes to like anti-candida supplements and stuff like that, right? They're still antifungal. They're really strong. That's why they work, right? And so we don't want to be taking those things long term. We really want to be careful, right? The same way as we'd be careful with the medication. You still have to be careful with supplements. So if you're coming in on 4 different GI supplements that all do different things, that's basically just code for you have no diagnosis, and we probably need to get a diagnosis. So that's my second one. My third one is a bit controversial, and it's every single time a woman walks into my office and they're on birth control to treat X. Insert X here, whatever that looks like for you, right? So if your birth control is to prevent pregnancy, yay, we're winning. That's what it's there for. But when it comes to treating things like PCOS, treating things like endometriosis, treating things, well, the list goes on and on, right? When it comes to treating things, birth control isn't actually treating things. What it's doing is it is masking those symptoms by lowering hormone production. Can it be really helpful for symptom management? 100%, right? If you are having endometriosis or you are having super heavy periods, birth control can be really, really a lifesaver for that. The question becomes, are you actually treating the problem, right? So you may be getting a normal period on birth control, i.e. it comes every single month, but it's not technically a period. It's a withdrawal bleed, which is basically when we withdraw progestins and we end up bleeding. So in terms of treating those kind of things, right, if you're really looking to get to the bottom of your hormonal concerns, birth control pill is not going to get you there. What's going to get you there is good labs and a good treatment plan. We're actually going to be doing some future videos on like herbs for women's medicine, which can be really helpful, so stay tuned for those. But there's a lot of things that we can do to actually treat it. A birth control pill is not doing that. It's just not doing that. And so that is my third thing. So sticking with our topic of being a bit controversial, my next thing is going to not be popular with a lot of people, but it is something that I definitely stick by. And that is anytime a woman comes in my office and tells me that she's intermittent fasting. There are a few exceptions to this rule, right? So there are actually some good research studies on PCOS and intermittent fasting, so that is a possibility. But in a lot of the time with women, what happens is intermittent fasting, well, not getting in enough calories, which is the majority of women, right? They're using intermittent fasting as a way to like curb their calories, and they think that they're doing a good job by shortening their eating window, but they're actually shortening the amount of, they're lowering the amount of calorie intake that they have, right? What happens when we do that is that kisspeptin drops pretty dramatically. And kisspeptin is a peptide that signals GnRH from your brain to signal your ovaries to make estrogen and progesterone. If we stop that production, what ends up happening is we lower estrogen and progesterone pretty quickly, right? First of all, I did a whole video on this because that has negative effects in its own, right? When we lower estrogen, the body wants to fix that. So it actually makes you more hungry, more likely to be not satiated. Because it knows that you're starving it, right? Along with that, what we know is that a lot of women are already not getting in enough calories, right? And they're already not getting in enough protein. And by shortening up that window, they're just eating less. And although that seems like a really good idea, right? In medicine, what we teach people is calories in, calories out, like it's just that. It's not. Your metabolic safety, which we talked about in, I believe, last week's video or the video before, might have been 2 weeks ago, the metabolic safety matters, right? And so intermittent fasting is going to be a way that women really change things for them. Oftentimes I have seen hair loss get worse with intermittent fasting. I've seen cycles get worse with intermittent fasting. So although it's like a bad thing that everybody thinks that they should be doing, I actually personally, when patients are telling me they intermittent fast, I definitely ask more questions to make sure they're getting in enough calories in that window, because if they're not, they're probably doing more harm than good. And you can watch my entire video on the intermittent fasting if you want more information on that. My next one actually goes back to a video we did a few weeks ago, which is testosterone replacement. So you guys know I'm pro testosterone replacement in women, right? I think it can be really, really helpful if it's well done. So why would I put testosterone replacement in a video where I'm saying that people are getting bad medical advice? Well, if you are young and you have not finished having kids, or you are considering having kids in the future, willy-nilly putting somebody on testosterone replacement is a terrible idea. It is contraindicated in pregnancy, which means that we would have to take you off of it. And oftentimes you're going to have better outcomes fertility-wise and kind of life-wise, right? If we take a more supportive approach. If we take an approach maybe with herbs, things like DHEA, things like that, to raise up your own testosterone production. Weight training helps with this a lot, right? Lift heavy things. If we can get your body to produce more testosterone, A, you should feel better, and B, then fertility outcome-wise, that's important in the future. So I think sometimes people just want such quick symptom management, which I totally get. My patients are all like that. But you have to look at age, and you have to look at where they are in their life, right? If they're not done having kids, that's not an appropriate time to do testosterone replacement. In the majority of women, there are always outliers, right? But in the majority of women, that's not an appropriate time. And so we really want to think about that. And then my last one goes kind of right along the lines of that, and that is progesterone without running labs. So first of all, I've done videos in the past on running progesterone, how to properly run it. It really matters when we run this, right? If we're running progesterone at willy-nilly times in the cycle, you are going to get zero information. And I will tell you that most of my women who come in my office that have had hormonal labs run, even at other offices where I feel like they should have gotten good labs run, they're not run on the right days. And so that doesn't tell us anything. But more than that, I had 2 patients in one day. I don't know what God is trying to tell me right now, but I had 2 patients in one day where their doctors told them to just keep doubling their progesterone dose until they felt better. Well, the first one that came in, we ended up running her labs. She was feeling like crap, and we ended up running her labs, and she had the progesterone of somebody who would be in the first trimester of pregnancy. And I told her this. I said, "Oh, your progesterone is quite high, right? These are levels that we would see in the first trimester of pregnancy." And she looked at me and she said, "Oh my God, is this why I've been so nauseous and why my husband opened up a energy drink the other day in the car?" And I was like, "That smells disgusting. Get that away from me." Yes, it is. Progesterone, even though a lot of people think obviously it's safe, right? And in younger women, it can be really, really helpful. That doesn't mean that you just dose it just off the cuff, right? You want to test things, and you want to make sure that things get into good ranges. And so that is definitely my last thing, is that progesterone shouldn't just be thrown around, and it should be done with testing. On top of that, it's one of my biggest pet peeves in young women when we just dose progesterone, but we don't do anything to actually help them ovulate or create progesterone on their own. I think that that should be done in tandem so that we can get women actually having a normal cycle the way that we would expect them to have a normal cycle. So these are some of my, we'll call them fun things that come up in the office sometimes that kind of make me take a step back. And maybe you've been given this medical advice, which means that it might be something to look at in terms of your care, or talk to your doctor about and get your questions answered. So put in the comments below if you've had any of these experiences, and we will see you next week for next week's video.